Hi guys, welcome to our gross anatomy lecture. Today we're going to talk about the elbow joint. So the elbow joint is the joint that is between your forearm and your arm, which is actually made by the articulation of the following. You have the humerus right here and the radius and the ulna. So you're going to have the articulation between the capitulum of the humerus and the head of the radius, the trochlea and the trochlear notch the of the of the ulna, and the olecranon fossa and the olecranon process of the ulna. The radial the elbow joint is gonna be a synovial hinge joint. What does it mean? It means it actually facilitates movement in one plane, that is flexion and extension. Flexion and extension. Right. Those are the main joints. Those are the main movement of the elbow joint. The elbow joint is going to be surrounded by capsule. As you're going to see, the capsule is going to attach above the margin of the coronoid, the radial fossa, right? And then distally is going to attach to the coronoid process of the ulna and the annular ligament of the proximal um, radio ulnar joint, as you're going to see. Take note, the capsule of the elbow joint relative to the capsule of the shoulder, we say that the capsule of the shoulder is actually thin and lax because of the circumduction movements or movement of the shoulder joint. But when you come to the elbow joint, the capsule of the elbow joint is actually laterally at the lateral and medial proximity. It's actually going to be thick. Why? Because the elbow joint facilitates only one plane of movement, flexion and extension, and it's actually going to be thin and lax in the anterior and posterior position. Right. The elbow joint is actually going to be surrounded by the articulating surfaces of the elbow joint. They are going to be surrounded by hyaline cartilage, and since it's a synovial joint, you're actually going to have a synovial membrane surrounding um, these articulating sites. So you're going to have 30 pegs, as you're going to see. Let me show you a picture. So right here in pink, you can actually appreciate the synovial membrane, and you actually see the 30 pegs found on the coronoid and radial fossa. Also at the apex of the olecranon fossa, we have another 30 peg over there. Take note of this. The synovial membrane of the radial of the elbow joint is actually continuous with the synovial membrane of the radial ulnar joint. So they are found within the same synovial cavity. Right. What reinforces this joint? So I think by now you must understand that every joint has to be reinforced either by muscles or by ligaments. Right. So the elbow is mainly going to be reinforced by the ligaments. So you're going to have a medial ligament and a lateral collateral ligament. Let's take a look at the ligaments of the elbow joint. Right, so let's appreciate the ligaments of the elbow joint. So this is going to be the medial collateral ligament, which can also be called the ulnar collateral ligament. This is going to be the radial collateral ligament, which can also be called the lateral collateral ligament. These two ligaments, they actually prevent adduction and abduction of the elbow joint, so that the elbow joint can only have flexion and extension. right? So it's actually very important to take note of such ligaments. So there's going to be a difference between the ulnar collateral ligament and the radial collateral ligament. Both of them, they are triangular ligaments, but there is an important clinical, an important MCQ difference that you actually have to appreciate. So let's take a look at another slide. Right, so right here, this is your lateral collateral ligament, which can also be called the radial ligament. So you can actually see that it is triangular in shape. It has its apex on the lateral epicondyle and its base running along the ulna, right? And it also attaches to the ulnar ligament, annular ligament of the proximal radial ulnar joint. And then this one is the medial collateral ligament. So the difference is this, that the lateral collateral ligament is just a triangular band, but the medial collateral ligament, it's going to be three bands that forms a triangle. So you're going to have an anterior band, a posterior band, and a transverse band, forming a triangle. You see, so that's the main difference. Good. So this is going to be your synovial membrane with your, you can actually see this is synovial membrane, your fatty pads, very important. And take note, the synovial membrane, as we said, of the elbow joint is actually continuous with the synovial membrane of the proximal radial ulnar joint. Let's take a look at what facilitates the movement of the elbow joint. Very easy, right? So for flexion movement, you're going to have the following muscles, and these muscles, they are found in the anterior surface of the forearm and arm, right? So the following muscles, you're going to have your brachioradialis muscle, your bicep brachii muscle, right? Your brachioradialis muscle, your brachialis muscle, your bicep brachii muscle, right? As well as your pronator teres muscle. They are going to be very important for flexion. As for extension, you're going to have the following muscles, right? You're going to have your anconeus muscle for extension, right? Your tricep muscle, right? Those are going to be important muscles for extension of the elbow joint. Let's take a look at what we call the carrying ankle. The carrying ankle. Right, so actually, if you're going to draw the long axis of the arm and the long axis of the forearm, they'll actually join and they'll give a lateral ankle. So the long axis of the arm and the long axis of the forearm, they actually give a lateral ankle, which is called the carrying ankle. So take note, in male, the carrying ankle is actually 170 degrees, while this in female, the carrying ankle is about 167 degrees. So in male, it's going to be larger than in female. And when the hand is, when the forearm is fully flexed, the carrying ankle disappears. The carrying ankle disappears. So that is what you have to take note when it comes to the carrying ankle. 170 degrees for the male, 167 degrees for the female. Good. Right, so at last, let's talk about dislocation of the elbow joint. So the most common dislocation of the elbow joint that we're going to talk about is the posterior dislocation. And posterior dislocation, it mainly occurs in children because the features that stabilize the elbow joint, which is the the structures of the articulating surfaces that stabilize the elbow joint, by in children they won't be formed. So the elbow joint won't be stable. So therefore, you're going to have more posterior dislocation of the elbow joint taking place in children. Thank you so much, guys, for listening. I hope this video was helpful and you were able to grab something. See you next time.